This outstanding course in implant prosthodontics equips participants with the knowledge and skills necessary to excel in the field of implant dentistry. From a historical context to modern treatment protocols and complication management, this course ensures participants are prepared to provide high-quality, evidence-based implant prosthodontics and care to their patients. So let me just explain a little more carefully. Oh, let's go back. Oh, Dr. Honorable, I gotta go back. Okay, here. Okay. Bear with me, Dr. Honorable.
No problem.
Nope, I gotta go back. It says it's still thinking, Dr. Honorable. I think I might go forward. Okay. Dr. Yuvan Honorable, myself, and Dr. Ibrahim Haroon have come together in a collaboration. Dr. Honorable, of course, has brought all the students from all over the world, including Nigeria, Kenya, and soon to be Ethiopia, and much more. Dr. Ibrahim Haroon has provided us with a location. The location is called Greater Washington Oral and Maxillofacial Surgery. And I am pretty much the middleman. I put all this together with regards to having us have a place where we can come together, having us have the sponsorship of a continuing education program and accreditation. Dr. Haroon has multiple associates in his practice. At the top picture on the right side, you can see Dr. Bhatti, and at the bottom, you can see Dr. Dogan, another oral and maxillofacial surgeon. We are a multi-specialty faculty to provide continuing education to general dentists and or specialists. We have Dr. Ricardo Ganfilippo, who is a periodontist who also participates in our faculty. Our first course was held July 29th through August 2nd, and our second course occurred September 23rd through 27th. All of them, both of them, were highly successful. It consists of a 5-day course curriculum. 20 modules of information are presented over the duration of the 5 days. Each of the modules includes suturing techniques, grafting techniques, how important it is if you cannot place a dental implant, how you can graft the socket. My nickname is Socket Grafting Girl, so I thoroughly appreciate going over how to add the particulate matter to the bone, to the site, so that then the bone can integrate. We also talk about direct observation of procedures. We allow the students to see how can you place an immediate implant, how can you place an implant in a edentulous space. In addition, we have a few trips during the course of the week. No. Oh. It looks like, Dr. Honorable, my computer has frozen.
Okay.
Yes. Is it frozen on your side?
Yes.
Okay.
Well, it's moving now.
In addition, Dr. Honorable takes a meticulous approach to teaching each and every student how to restore implants. We use hands-on models so that you are not putting the models in your hand, but more importantly, have it organized and oriented so that it is very similar to being in the patient's mouth. We go over each of the parts and pieces for restoring dental implants. We show you the surgical protocols of how to start from a pilot drill and sequentially getting larger and larger in diameter to your final drill and then to your implant placement. Dr. Ganfilippo zooms in with us and gives us his periodontal perspective. We start by measuring the site when it's in a dentulous space so we can see the difference between where the tooth is located and how large the edentulous span is. And then we help you plan pre-surgical planning utilizing CT scans of where the implant should be placed. We do have a guided surgery component to our curriculum, and we thoroughly evaluate how important it is for a new implantologist to utilize guides. Each of the students have come, as I have said, from so far. Every student receives a binder with their first and last name and their location. Again, we've had students from California, we've had students from Alabama, from Atlanta, Georgia, from North Carolina, from different parts of Nigeria and Kenya. We are an international program, including an international faculty. We have a multiple auxiliary participants, including 3D diagnostics, comes in and talks about surgical guide and surgical guides that can be utilized during the placement of implants. We also have auxiliary participants such as CareStream. Our friend down at the bottom, her name is Kim Novak, who represents CareStream, to tell the students how to properly take 3D images and then trace the inferior alveolar nerve or trace anatomical structures such as the sinus so that we can then go on and discuss surgical planning of implant placement. We also have an opportunity for the students to participate with intraoral scanning. One of the things that's very important is that we want you to see cutting edge technologies. We want you to be aware that we don't necessarily have to take impressions, pour up models, send them to the lab, but in fact, there are new budding cutting edge technologies, including intraoral scanning, which you can see is demonstrated. We participate, one of the students will be the patient, and then all of the students get to observe. We also show the students how to do extraoral scanning. Dr. Ibrahim Haroon on the top left allows the students to observe the cases during the course of the week. Being inside of a oral surgery office during the 5 days of the course really gives students the opportunity to see things right up close. At the top right, we also teach students how to place an IV, which is what we believe a life skill, just like swimming, you should be able to know how to place an IV. And again, down at the bottom, Dr. Anarobi and I, and a BioHorizons representative are present in that photo. BioHorizons comes in and also goes over all of the parts and pieces to placing an implant and how do the implants work with regards to the healing abutments and the drivers, the surgical drills, so that you can hear it also from a representative of an implant company. We take a trip, as I mentioned. One of the 2 trips that we take is to a dental lab here in Chantilly, Manassas. It's called the YM lab. It comes with 2 hands. The first hand we'll see where they take impressions, send it to the lab, maybe pour up a model with stone, send it in so that it can then be made to have a crown. The second arm is the digital workflow. So we see if a practitioner sends in an intraoral scan, how does the intraoral scan then become a 3-dimensional image? How is that 3-dimensional image utilized to then have a crown milled? So the exposure that the students receive by going to the YM lab is like no other. One of our participants from Nigeria, his name is Dr. Kola, remarked that this really was an eye-opening experience. It gave him more of an understanding of things and possibilities in dental technology, and he really appreciated being able to have that exposure, especially being a prosthodontist. The second trip that we take is we go to Washington, D.C. We can't have folks coming from so far all over the world without coming to the great city of Washington, D.C. We show them the Washington monuments. We show them the Washington Capitol. You can see the Capitol behind me there. And we also go to a trip to the Martin Luther King statue. And we really let our hair down. One of the things that is most remarkable of our 5-day curriculum is the camaraderie, the fellowship, the ability to build lifelong relationships. It also helps us to implement mentoring. All of our faculty follow the students after the 1 week curriculum, and we have a mentoring opportunity so that if there's ever a question, now you've gotten into private practice, now you want to implement the training that you've learned, perhaps you want to call us, give us a call, let me know. Oh, I was able to take the tooth out, but I wasn't able to place the implant. We grafted it. We used particulate matter, just as you have showed us. We used sutures and a membrane. So we want to continue to have those kind of dialogues and those conversations with students even after the program is over. We go over all of the instrumentation. We go over all surgical instruments. We offer to provide you a set of surgical instruments if you choose while you attend. This is one of our students named Dr. Ada. She came here from Texas, and she was a very good student, very engaged and interested in how to place dental implants, and she was already familiar with how to restore them. Dr. Dogan is at the top, giving us a very in-depth discussion on how to place IVs. As I mentioned, we believe that is a life skill that everyone should be able to be aware of, not just in the top of the hand, but also in the crux of the elbow. We show every student how to place an IV and secure it. Julio, one of our favorite auxiliary participants, is a dental lab technician. He comes from Artifacts Lab. As you can see very carefully down on the bottom right-hand corner, he has the model in his hand, and we teach general dentists and students how to temporize implants that they would have placed. So in the example that there's a patient who is missing anterior tooth number 8. Well, if we show you how to place the implant, we want to show you how to temporize it. We don't expect you to have a suck down and an Essex, or a suck down and a flipper, or some kind of replacement that wouldn't be readily available. We want to show you how to temporize implants chairside within 10 minutes with all the appropriate tools. You all are already artists. That's part of being a dentist, is to have the nature of being an artist. But we know that making a crown is not far-fetched. We can show you, okay, you're going to use contouring, you're going to use a Dremel perhaps to smooth it, make sure it's out of occlusion, so that that patient can leave with something the day of the procedure. In addition, as I mentioned, it's direct observation. In this particular photo, Dr. Haroon is showing you the depths on the drill bit. He is also going to be placing an implant. All of the students get close up and personal. In this one in particular, we also drew blood and utilized the centrifuge, which is behind the student. The centrifuge mixes the blood and separates the plasma from the serum, so that now we can use PRF. PRF is a additional bone grafting supplement to allow for the molecules of the blood to aid in the healing process and also reduce the inflammation. So we want to show you all the different things that are possible in implantology, making implants a success for the future. We have a lot of women in our practice and in our institute. I like to teach women so that you all can navigate the world and you can provide services. Sometimes us women, we don't always get the same opportunities. So I'm proud to say that out of all of the students, more than 50% have been women, and we are still here to provide education to all. But I do have a focus on any women who are interested in surgery. I, being an oral and maxillofacial surgeon, I'm one of the few African American women in the whole state of Virginia who's an oral surgeon. So I strive to make sure that I don't always say that. I want to one day be able to say that there's more women surgeons. This is a photograph of some of our graduates. Everyone gets CE credit. Everyone receives CE from the American General Dentistry Academy. I went through the process of getting the PACE certification, so everyone receives 40 CE. We do provide recommendations for hotels for those that are out of town. We provide food and transportation. And if I didn't mention it, every single participant receives ACLS, BLS, and PALS training and certification. We have some upcoming courses in January 13th through 17th, February 24th through 28th, and April 7th through 11th. Please register now. And then to take this to the next level, we also will be taking International Implant Institute to Cancun to provide live surgery continuing education. That opportunity is new on our curriculum. I did have an opportunity to go to Cancun to evaluate the dental clinic to see what was the setup so that we can provide the service. We don't want to just kind of leave. So in fact, we are going to be providing the service to the patients of Cancun, Mexico, and our assistants will be the general dentist that will restore the cases. So now we've brought all the team players together, we being the surgeons, them being the assistants that are going to be the restorative dentist, and also the patients, so that the patients kind of have a continuity of care. We'll place the implants, but the restorative dentist will then take over for the final restoration. Please check us out at INTLINTINSTITUTE.com. That's internationalimplantinstitute.com. You'll see to the left the registration. The course is, again, 5 days, including 20 modules, 40 CE, continuing education credits, in addition to CPR, hands-on model surgery, direct observation of procedures, and the cost is $2,650. Thank you, Dr. Honorable. This would not be possible without you, and we strongly appreciate everything that you've done. Please join us at International Implant Institute.
All right, thank you so much, Dr. Jackson. It's a dream that is, I mean, we just started talking about it, and before you know it, people are buying tickets and traveling and getting on planes to come to Manassas, Virginia. So every dream comes to pass if it is well nurtured, and I know this one is a good thing because it gives you a lot closer. You get hands-on and supervise, ask as many questions as you want. It's a wonderful program. We're looking forward to Oluwaseun. She just got Dr. Osim from Nigeria, just got a visa, so she will be coming in January, hopefully. And there's a gentleman from Dr. Mahiga, all the way from Tanzania. He's looking forward to joining the January class. So the link, I'll put the link on the chat section so that we can get involved, and looking forward to seeing you in one of our programs we have in January. Can you go back to the slide? I know you have the dates for January,
Absolutely.
February.
Absolutely. The dates for January.
Yes. 13th to 17th, something like that.
That's right, 13th to 17th. In addition, we have February 24th through 28th and April 7th through 11th.
All right. So, if you're interested, take a screenshot of this, and we'll fill the application, and we'll start talking. Thank you so much, Dr. Jackson. I really thank you, Dr. Cooper. Dr. Cooper, are you still there? Anyway.
Yes, I follow orders.
Yes, thank you, sir.
I was told to be there. So.
Thank you.
Julia, what you're doing is really remarkable. And you come from a really strong background. I know where you're trained, and you were part of the Arizona program, weren't you, with my friends at Horizons? Yeah.
I was implant pathway.
I'm going to check up with my dear friend at BioHorizons and get the scoop. But we're only an hour and a half down the road, so we might have to talk about what we can do.
I would love for some of the VCU students to participate. We're going to have what we call a weekend of wisdom. It's a play on words, wisdom teeth, so wisdom. But we're going to have a Pearls of Wisdom weekend, January 17, 18, 19. Yeah. We had one back in October. It really was a wonderful opportunity to foster some of the dental students. Several of the Howard University dental students participated. I had a little feedback from the VCU folks, and they said that they wanted to be hands-on, not just observation and lecture, because they're getting that at VCU. So actually this time in January, I'm going to do my very best so that it actually has a hands-on component, so that they do travel up maybe 2 hours or so, but it's thoroughly worth it. In addition, they can stay at the hotels if they need to, and then they can get back to the class on Monday.
All righty. Well, thank you very much. Now I am going to run. But
okay, thank you.
Thank you all.
All right.
Take care, sir. Bye-bye. All right. Thank you, Dr. Jackson. Looking forward to our next meetings, and obviously building this coalition of how changing the way implant is learned is our goal, and we're going to do it.
Absolutely. Thank you, Dr. Anarobi. You're the best.
Thanks.
Bye-bye.
All right. Soon we're going to have Dr. Hassan. Dr. Hassan is going to talk about treatment of biologic width violation and over-contoured restoration. Dr. Hassan is a clinical instructor at the University of Michigan, and he will join us. His meant to start by 3 p.m. Eastern. So we do have some time. So if you have any questions, I guess for the next couple minutes, we could go ahead and just talk about what we have heard today. And if anybody has any questions, you just lift your hand and I'll